Hello everyone, it's been a long time. This is the question I was discussing on the group. Which of the following diagnostic techniques is of no value in the diagnosis of neural tube defects? The options are amniocentesis, chorionic villus sampling, maternal serum screening, ultrasonography, or none of the above. Now, what do you know about neural tube defects? What is it? Is it a structural abnormality or a genetic abnormality? Is there an associated specific genetic abnormality to it? Neural tube defects are basically structural. Alright, structural anomalies in the development of neural tube. Neural tube doesn't close properly. So neural tube closure is defective. Genetic, it is primarily not a genetic condition. It can be associated with a few genetic conditions, a few syndromes. It is mostly associated with folic acid deficiency, different conditions which lead to this, or it can be associated with certain syndromes. So there is no particular genetic abnormality that you can associate it with. Like when I say thalassemia, alpha thalassemia or beta thalassemia all have their specific genetic mutations which can be used to diagnose these conditions in the prenatal period, in the fetal period. Alright, so these are mutations leading to diseases. Neural tube defect might be associated with some genetic mutations in these syndromes, but there's no specific genetic abnormality which is always associated and which can be used for diagnosis of neural tube defects. Alright. So, how is the diagnosis done in the prenatal period? One is, since it's a structural abnormality, USG is going to help. Alright, so USG, either you see the defect like anencephaly may be seen in the first trimester, or you see spina bifida, or there are certain markers, signs like banana sign of the head. There's lemon sign. You will have to go and read these signs. These are important. So these will tell you that either there's a suspicion of neural tube defect or it is confirmed, right? The other thing is, if it's an open neural tube defect, it causes leakage of fetal substances, fetal proteins into the amniotic fluid and subsequently into the maternal serum. Alright, if you have seen the previous lectures which I have put up, I have said that alpha fetoprotein is analogous to albumin of adults. In the fetus, this is the protein which is most abundant, like albumin is to the adult human being. Basically, I mean to say that whenever there's a defect in the integument, whenever there is an open neural tube defect, this leaks into the amniotic fluid and then into the maternal serum. So if you have high alpha fetoprotein in amniotic fluid or in maternal serum, there's a suspicion, it raises a suspicion that the baby could have an open defect which could be a neural tube defect, right? So this, and most of the times an ultrasound will give you the suspicion that there could be a neural tube defect. So out of our options, USG is there, amniocentesis is there, maternal serum testing is there. Coming to the fourth, the other option, chorionic villus sampling. Now tell me, what does chorionic villus sampling yield? When I do a chorionic villus sampling, what do I get? I get cells from the placenta of the fetus, from the chorionic villus. What do I use these cells for? I use these cells for DNA analysis. I either do a karyotype, or I do chromosomal microarray, or I do a FISH. I try to find out if there's a particular genetic abnormality or if there is a chromosomal abnormality. As we have discussed, there is no specific genetic abnormality associated here. Alright, so this CVS to get cells is not going to be of much help. Can you do a biochemistry test from chorionic villus sampling? No, you don't usually use these cells for any biochemistry. You can use amniotic fluid. You can use the fluid for biochemistry. You can use maternal serum for biochemistry, but you can't use CVS for biochemistry. So CVS basically is of no use in detection of any structural abnormalities. Like I say that my USG suggests that there's a heart defect. Will CVS be of any help? It won't be of any help. I don't want to know about a particular mutation. I just want to know whether the baby has a heart defect or not. I will have to do a detailed targeted ultrasound. I'll have to do a fetal 2D echo or anything. But this cellular diagnosis, DNA diagnosis is not going to help. I say that the family carries history of, say, an X-linked disorder, or there's a thalassemia history, or there's mental retardation history. This could be the FMR gene. So when I say a specific genetic abnormality, then CVS can be of help, but not in a structural abnormality where I don't know which specific genetic or chromosomal abnormality is associated. Alright, so your answer here is chorionic villus sampling is of no use. Now see, the most common case scenarios in diagnosis of neural tube defects in pregnant women is either in the first trimester she got a USG done and there was a suspicion that there's a neural tube defect, or she got a triple test done. Triple test, if you remember, is maternal serum AFP, beta HCG and unconjugated estriol. This will show raised AFP. So both these things suggest that there's an increased risk for neural tube defects. Now how do we confirm the diagnosis? Earlier what they did was they would do amniocentesis in all these cases. Apart from, now amniotic fluid will also have raised alpha fetoprotein. So that is one. Second is acetylcholinesterase. Acetylcholinesterase. This is secreted into the amniotic fluid from the neural tube defect. Alright, so if AFP is raised and if acetylcholinesterase is present in amniotic fluid, it is 98% sensitive, it is suggestive of neural tube defects. Here you can have false positives and you can have false negatives as well. Mostly false positives are a problem. False positives can be there. So now what we do is, the better way to detect it is, detect neural tube defects is a targeted ultrasonography. With the improvement in ultrasonography technologies with availability of 3D, 4D USGs, you can very well diagnose if a neural tube defect is present or not. So 99% cases or even more, most of the neural tube defects can be diagnosed using a targeted ultrasonography. Alright.